it accessible. So I think this is something that we need to also, have a dialogue about, because healthcare that is not affordable is not accessible. And when we're looking at accessibility, I think this is one important thing that the governments could work with the private sector on.
If I may add just a point that the first thing, I think if you haven't discussed it earlier, if I might have missed it, it's just that I think most of us as women put ourselves on the back burner, putting the family in front, ahead, putting children ahead. That if that mindset slowly and steadily through these training programs, that I think will be our first barrier. If we can break that, especially in the rural areas, I think we face that heavily, and I'm sure doctors are aware of it. ఇప్పుడు నాకెందుకులే, let the child, పిల్లలు చూసుకుందాము, పిల్లలు చదివిన తర్వాత మనం మా హెల్త్ చూసుకుందాము, that mindset is there. I think somewhere that if that changes, I think things will change.
Thank you very much. And to conclude, yeah, please, Vijay.
Ask one question.
Sure. To the moderator.
Sorry. So, a lot of information is floating around in social media about the virtues of going on fasting.
This is a hypothesis that's been created and this floated across all WhatsApp groups, that whoever takes, even our patients, they come to us, they're not eating at all, and they say, if I eat ice cream, cancer will develop. So you need some kind of a glucose anyway. The brain will function only with glucose, nothing else. Fat and proteins don't reach the head. So brain requires CHO. So it's not proven, but it makes sense in discussing. But we need a balanced diet. We need CHO, protein as well as fat. Less of fat, less of glucose, and more of proteins. That is the bottom line. So to conclude, we all agree that women's health is very, very important for her. It's not in the backdrop, but it should be in the forefront, because she is the anchor of the family, and unless she is there, nobody else is there in the family. So it's very, very important for herself, family, society, nation, and the universe. So we all understand the importance of health, and health is wealth, and prevention is better than cure. For prevention, what we need to do, we discussed all through. So good diet, balanced diet, as I said, less of carbohydrates, don't become obese. Obesity is one of the important factors to develop cancers. So good exercise, at least any sport is very good for you. Exercise is not strolling around and walking around for youngsters like you. You should get into any kind of sport. Sport is the best medicine and the best meditation. So besides that, regular screening is very important for people who are above the age of 35. Compared to other parts of the world, our generation, at 35, people are getting cancer. So other countries in the Western European countries, they said 40 and above, or 45 and above. But for us, 35 should be the limit to start screening. Screening is something that you send your vehicle for servicing at 5,000 kilometers. Why can't you send your body for servicing? So it's as simple as that. You spend 2,000 rupees for servicing for your vehicle without any problems. You're sending it to servicing center. So send your body also once in a year to diagnose without symptoms. You're diagnosing a disease, obviously means it is an early disease. So you will get away by simple treatment, easy treatment, and cure is guaranteed. So screening is very, very important. Please do spend some money for screening. And whenever a hospital comes out with an ad of screening, people say it is commercial. Not true. We are all subsidized perennially in Apollo Cancer Hospital. Even this initiative we are doing for 1,500 rupees, which is 70% subsidized for cancer screening for any woman walking perennially at any point of time. So mammogram, pap smear, ultrasound, everything is done. So please get aware of it, and please send your moms and dads for regular screening. So don't be scared of cancer. As Vijay was chatting with me, he was telling me people are getting scared to go for diagnosis because they are suspecting that they are going to be diagnosed of cancer. That is unfortunate. So if you have any symptoms, don't shy away from going to the hospital. Get investigations done. Every symptom does not mean that you got cancer. You may have cancer. So when you diagnose cancer at an early stage, you're going to get cured. So just be alert. That's all we wanted. So as we honor the strength and resilience of women today, let us remember that self-care is not selfish. It is essential. So let us prioritize our health, both physical, mental, knowing that by nurturing ourselves, we empower ourselves and pave the way for a brighter, healthier future for all of us. On this Women's Day, I wish and urge all the women to please take care of your health and stay healthy for yourself, as for the family, and for the nation. Wish you all a very happy International Month. March is taken as International Women's Month, and enjoy your day. Thank you very much for gathering here. God bless you all.